Yeah.
Buddy? Everybody was able to make it here through the tree debris today. So, I'd like to call to order the Public Health Committee meeting for Wednesday, July 17th, 2024. Please call the roll.
Juby here. Silva,
Good morning, Silva here.
Tarver,
Tarver's here.
Williams,
Williams present remote.
and Young is not here. Sanchez,
I don't think he's here either.
Okay. Strathman.
Present. And I would like, with your permission, to have permission for Mr. Williams to be remote this morning. Any objections?
I'm not even on the committee.
Okay. Do we have a quorum? Okay, thank you. All right. Okay. Today is, I'd just like you to know, this is the 199th day of the year. And it is World Emoji Day. So you can make smiley faces on everything.
It's the beginning of the Kane County.
It is also the beginning of the Kane County Fair. Which, doesn't it always rain for the fair?
Or it's hot. There's tornadoes.
Yeah.
Ungodly heat and then sometimes rain.
Yes, right. Okay. Okay, I would like to ask for unanimous approval of the minutes for May 22nd. Anybody? Okay, I'd like,
I move we have unanimous approval of the minutes from May 22nd, 2024.
Silva seconds.
any objections? Okay, they are approved. Okay, and the public speaker we have this morning is Jeannie Meyer.
Be on agenda.
Okay, yeah, there you go.
Jean Meyer, Christian, resident, master's prepared, registered nurse. First, do no harm. I remember well my public health rotation in 1982 as a nursing student, Omaha, Nebraska. We were told to wear running shoes and I was afraid. But remembering those memories, my question is it the taxpayer's job to provide such services at the burgeoning bureaucracy? History tends to repeat itself. And so a large percentage of the Black population in New York City, or in New York, I believe, refused the clot shot, also known as a COVID vaccine. Just ruled by the US Ninth Circuit Court, and that's on the liberal left coast. They just ruled that it is not a vaccine. You can't call it a vaccine because it does not stop the spread of disease. Blacks intelligently feared the clot shot, which was preferentially given to people of color because they had a public health history. Oh gosh, it makes me shake. In 1930s, the US Public Health Service experimented on Black males with syphilis to see the natural course of untreated syphilis. Does it make you cry? Would we do the same? There was no informed consent. Despite a cure in 1947, penicillin treatment was withheld. 128 people, and I have to say we all do die, but 128 people died. 40 wives were infected and 19 children were born with congenital syphilis, and I bet it was worse than that. People are sheeple. We tend to go with the majority, and we tend to take orders from the authorities. Would you have gone along with the Tuskegee Institute experiment? Please question your heart honestly. When you go home, would you have? They all did. With the experimental COVID clot shot, there was no informed consent. In fact, the vaccine manufacturers were going to withhold the whole truth for 75 years till we were all dead. We were and are still told, take it. Safe and effective. The CDC has called me twice in the past week because they want to do a survey to find out what I think about the COVID vaccine and other infectious disease vaccines, they will not relent. It has been added, this COVID clot shot, it has been added to the massive and growing number of toxic shots in the childhood vaccinations. First, do no harm. Dig your heels in and tell the people holding the tax money on strings called grants, we will exercise local control. Say, we will immediately stop pushing COVID clot shots. Former CDC Director Robert Redfield says, it is not a question of if, it's more a question of when we will have a bird flu epidemic. He admits to bird flu being weaponized in the laboratory. Why not this board craft a statement to the global, national, and state toxin pushers to cease and desist and to stop the weaponizing of viruses in the laboratory? In Colorado,
Thank
there's
you,
a
Ms.
lab that's
Meyer, your
messing with,
time is up.
that was 5?
We're doing 3 minutes now for everybody.
Oh. Okay, well, I would say first, do no harm.
Thank you. And now we have the reports are on file, the financial reports. Do we have any questions about those? Okay, and with your permission, this morning, I would like to change the agenda just a little bit, and if we could move now to executive session for release of closed minutes. Did I say that correctly? Okay, good. And so we need to take vote to go into closed session.
Need a motion.
First, we need a motion. Thank you.
I motion that we go into closed session for the review of closed session minutes with a possible vote on them in open session.
Do I have a second?
Second.
Thank you. Okay,
Roll call.
thank you. Roll call, please.
Juby,
Juby, aye.
Silva,
Silva, yes.
Tarver,
Harper, yes.
Williams,
Yes.
Sanchez. Okay, Strathman.
Yes.
All right, everybody online that's going to be joining us, please accept the invites. We are live streaming, so until I give you the okay, anything you say will be going out live to the public. If you are in the room and joined the meeting digitally, you must also join before we can begin. So please accept those invites.
Thanks.
Wait. We haven't. You asked yesterday. Carol, the sheriff wanted to know, can he be in or should he be out?
You can be out, I think. Take a break.
Yeah, real secret stuff.
We are still waiting for one person to accept the invite.
Yeah.
We're still waiting on one person to accept the invite to go into the closed session. We cannot go in until we have all people in the closed session.
Okay. We are not in closed session yet.
I don't like it.
I know.
Yeah. I believe you're a roll call vote.
All right, you are in open session.
Roll.
Juby,
Juby here.
Silva,
Silva is here.
Tarver, Williams,
Williams online.
and Strathman.
Strathman here. Okay, now we need to vote. Now we're going to vote on the release of the minutes that was recommended by Mr. Cermak. Okay, so call the roll.
Do you need a motion?
Oh, thank you.
Motion, yeah.
We,
Motion would be to release the minutes as set forth on Exhibit A as submitted by the state's attorney's office.
So moved.
so moved. Juby?
Seconds.
Tarver seconds, thank you. Please call the roll.
Juby,
Juby, I.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Yes.
Yes.
Strathman.
Okay, maybe I'll get that right, but if we do it a few more times.
Thank you, everyone.
Okay, thank you. Okay, now moving right along on the agenda. Good morning, Mr. Youngstad.
Good morning, everybody. All my reports are on file. If anybody has any questions, please let me know. There is one note to point out, because we didn't meet last month, so I want to make sure it's addressed this month. If you look at my line item for NICOR, we owed $24,000 to NICOR that we found out that was not paid for the last 2.5 years. There was an issue between NICOR and our email system that the bills weren't going through. That was actually a couple departments that got affected here in King County. So that had to be rectified, of course. So that was paid. So if that line item is like 1,000 times above where it's supposed to be, I just want everybody to know why it was so high. We just wanted to make sure that we got back in compliance with NICOR because we need them for heat and everything else. So that's why that line item is so high this year. But if anybody has questions on my report, please let me know. Our next vaccine clinic flyer has been released. A little bit flashier, a little bit different. We're trying something different to see if we can get different people's attention. If you continue to do the same thing and get the same results, you get shocked. So we're trying something different. Little bolder, a little flashier. We're hoping, especially at the local libraries, it'll help grab people's attention. But our new final 3 dates have been released for the year, and that's the August 3rd, the September 1st, and the October 5th. If you know anybody that's looking, please let me know. If you would like flyers to hand out, please let me know. We try to get them out as much as we can, and we're going to do a Facebook campaign too that will also get them out a lot coming up here shortly.
Very cute.
Thank you. The other thing is I have my, did you want to move on to the,
Yes.
sorry. For the budget, I know missions and goals, I believe is what we're told to present. So I have them posted. If anybody has questions, please let me go, let me know, excuse me. Or let me go, sure. It basically covers along our mandates of what we're trying to do here. Our numbers on rabies registration continues to grow every year as we continue to enforce that. Our bites continue to grow every year because as our population gets larger, that's going to happen. So that kind of goes hand in hand, and same thing with stray dog pickups. Actually, this year did have a little bit of a dip, but with the 24 numbers, I wrote this 2 months ago. So we have a lot more information now that people are surrendering animals left and right. People are returning adopted animals left and right. Our population is one of the highest it's ever been. And we're doing what we can to keep control of that and not have to limit services to the municipalities, because that's the first thing I would have to do is limit intakes. We by law have to pick up unincorporated King County. We do not have to do municipalities. We have a resolution coming up for that contract. But I don't want to ever get there because stray animals have to go somewhere in this county. We would rather keep them centralized. We would rather keep ensuring that we reach out. We have all the resources in place to make sure we're marketing these animals through Facebook, through our webpage, to help get lost animals reunited with their owners. So we don't ever want to see that happening. But just letting everybody know what's going on right now, sort of thing with our population. But if you have questions, we're also not changing our, sorry, Blair, page 2. Sorry. Our position count is not changing. One thing we are doing is HR did that wonderful study. And one of the things that came out of the study was half our department is at 35 hours and the other half is at 40. I never understood the reason for this. So HR was able to look into what other municipalities are doing with part of that study, and we really appreciate their help with this. So we are moving everybody to 40 hours this year. The goal in that is to get a lot more work done, which will hopefully process a lot more records, a lot more of our tickets that need to be put out, and help all around kind of fix some issues at the shelter. It's going to take away some stress because right now the staff's coming in right when the shelter opens, they leave right when the shelter leaves. So those people that come early, those people that come late, it causes a lot of stress and anxiety, especially we're always trying to keep control of our overtime. So this is going to eliminate a lot of that. So we're actually very excited. We've had detailed discussions with the staff about what it means. And 3 of the people in there are management. So it's going to be nice to have that expertise continue to be on campus for an additional 5 hours per person per week is going to be a huge benefit to this county. And that's the only large change to our budget this year, please.
Good morning. So did I understand correctly that the adoption hours were going to be limited on Saturday?
Yes. So right now I had, if you look at our flow chart, we have 5 kennel staff, 4 left me. So I'm down to 1 kennel worker. So we're trying to hire as fast as we can. I have other positions filling in, especially on the weekends. So it's limiting who I have available right now. So just due to staffing levels, I'm stuck. We're hiring. We've just made 2 tenders to 2 part-time people. We actually this week just brought on a full-time person. So I mean, we're moving forward. We just need to get everybody up and trained on how to do the adoptions, what it takes, what they need to do, because it's not as simple as just here's Fluffy. I don't know anything about Fluffy, like getting to understand what needs to be said, what needs to be presented, and how it needs to be done to also make sure we're getting the right adoptable animal into the right home.
I do understand your reasons and I very much trust your judgment. It just does seem counterproductive if we have all the animals and then we can't get them adopted out because a lot of people work late. So this is great that you have a plan. Any idea of when we would start opening up adoptions on
I'm
Saturdays?
hoping within the month.
Oh, that's, yeah,
it-
it's very fast.
I'm not happy with this idea either. Trust me, this is not where I wanted it to go to.
I trust your
I'm
judgment.
just stuck based on staffing levels because the
Sure.
people that are filling in on the weekends right now are already putting in a 40 hours of the week. Then they're coming in on the weekends. And my kennel staff's already burning out too because they've been trying to fill in with so many extra hours. It's just a limitation on staff. I've been able to kind of stretch it as long as possible. The good news is 2 tentative offers have been made. 1 has already been hired. So we are in the process of getting restaffed, which is great news. So we're hoping this is just the tail end and we're going to get it cleaned up first. So
Sounds
hopefully
good.
they'll be fixed here very soon.
Great. Questions, Mr. Roth?
Yes, Roth here, Brett. You mentioned half the people went from 35 to 40. Does that allow you to cut down on overtime? I'm not sure what percent you're doing overtime, but
We're hoping that it will eliminate some of that need for overtime because when we
Okay.
fall behind, especially with different types of work, it
Right.
puts stress on the facility and then people are putting in overtime. So yes, we're hoping to eliminate that
okay.
because the additional staff inside the building will hopefully
Okay.
correct a lot of that
And
action.
not that I want to assume, I'm assuming overtime's time and a half. So potentially could save you a little bit on salary.
Correct.
Okay.
From minus the wardens, our wardens are on call 24/7. There's nothing I can do about that. We always have to be
Sure.
available. We're always
Right.
going to be picking up strays. We're always going to be doing cruelty cases, things like that. But at least from the rest of the staff, if I could eliminate any overtime there, at least it focuses on those that need it. Then now the only overtime we're talking about is the vaccine clinics, and those are already self-funded. So they'll put back the funds that are being utilized out. So should eliminate the need for any adjustments in those categories.
Thank you very much.
Of course.
Any other questions? Yes, Ms. Juby.
I'm a little late. Could I get 10 copies of your flyer?
Of course you can.
Thanks.
Would you like them emailed or printed? Sorry.
Actually, I'd like them printed because I'm cheap and I only have a black and white at home. So,
Not a
yeah,
problem.
thank
Thank you.
We could give you some crayons.
I'm good with crayons.
Any other questions? Okay, thank you.
Thank you.
All right. And do you want to, shall we do your resolution now?
Sure. Every 3 years, we renew our contract with the Metro West Group. Those folks over there, the good news is this contract has absolutely no change for fees. So the fees are going to stay exactly the same for the municipalities for picking up stray animals for at least the next 3 years. So I know the municipalities were very excited when they heard that. The only changes that really were put in is the first contract will be for a length of 2 years. Reason being is because once you guys approve it, then they have to take it back to their committee, approve it, then every individual committee has to take it back to get it approved. And it's just so many steps that their people and us both, we actually both agreed to this immediately, that can we at least push the first contract for 2 years? And then we'll do a 1-year renewal, and then we'll come back for the renew contract every 3 years. So that was one of the big issues we found. The other issue, Blair, can you change the page? Forward, sorry. Forward. Sorry, back. I'm sorry, you don't control. Back one more. There it is. There is a whereas clause about respecting departments. We've had some issues, and I don't want to get into it here. If anybody would like to talk offline, I'd be more than happy about it. But there was an issue with respect to people that work for my staff coming from some of the municipalities. So we did have to put in here a clause. And if you read through, I'm sorry, it's not up there right now, but if you read through the details, it is in there. About what happens if there is a lack of respect for another department. And that is something we're sad that had to be addressed. But after meeting with the union, it's something we all agreed had to be put in. And it goes both ways. It's the same thing. My staff should not be disrespecting you as much as your staff should not be disrespecting my staff. So we did have to put some policies and procedures. Other than those two things, the contract is exactly the same that we signed 3 years ago, which is the same as what we signed 3 years before that. Any questions?
Could I have a motion and a second for this?
So moves.
Okay, that's Dr. Silva and Mr. Tarver. Thank you. And questions?
Yeah. Ken Shepro, Special ASA. You've mentioned during your report that the volume that you have now might require potentially the municipalities might not be getting the same level of service. I'm wondering how this agreement with Metro West could be affected, or what effect it would have on your ability to do that, if any.
We're hoping to not get to that because, like I said, we want to be the main stray collector of the county because it keeps information centralized for people, which makes it easiest. In this contract is the exact same language as before. I can write a letter to the municipalities, letting them know that effective this date, we won't be able to accept strays. And I will send out a secondary letter per the contract telling them when it's open again. I don't want to get to that because, again, I don't believe we should have strays all over the place in this county. Keeping them centralized makes it so much easier for people to reunite with their animal, and that's what we want to keep consistent. But there is a clause in there should it have to get to that, and I hope to never have to use that.
Thank you.
Any other questions? Yes, Mr. Roth?
This is Roth here. Was a study done on costs? Are we in, that we're not paying for out of county, out of your funds per se to the metropolitans?
No, the agreement is set up so it's a wash. I'm not
Okay.
looking to benefit.
No,
from
and I'm not
this.
saying you
And
need to
it's-
make money.
No.
But I want to cover costs, right?
And that's exactly what it's doing. We actually calculated it out and I presented all the data to the Metro West. Actually, we did this 3 years ago.
Okay,
We are right in that everything's perfect, which is why we're very happy that rates don't have to
Okay.
go up because this does affect the municipality's ability to approve how many strays we can receive. So we want to make sure that we're partnering with them as best as we can. And this has to be a win-win. Again, wanting to ensure the strays come to
Understand.
me, I want to make sure that this benefits
right,
everyone.
right. Is it charge per pickup or is it?
Yes.
Okay.
It is per pickup. And if they actually bring it to me, they don't get charged to pick up. Again,
Okay.
it's only covering the basic needs cost. and
Of
that's
your
exactly what
labor.
it's supposed to
Okay.
do. Yeah.
All right. Thank you.
Any other questions? Okay, clerk, please call the roll.
Juby,
GBI.
Silva. Silva, yes. Tarver,
Carver, yes.
Williams,
Yes.
Strathman.
Yes. Passes. Okay, and now, good morning, Mr. Director Michael Isaacson, Executive Director.
Good morning, everyone. Nice to see you all. We have a lot we're going to go over today, but I'll keep it at a pretty high level. But if anybody does have any questions or you'd like us to do some follow-up presentations in more detail, we're certainly happy to do that. But today we're going to be talking about our community health assessment that has just wrapped up, the new strategic plan that we've just introduced within the health department, and then also providing our budget overview for county fiscal year 2025. Before I get into those items, though, I'd like to give a couple quick updates. One thing that's exciting in Director Barrett's group, we have our home visiting programs, and many of you may know that the model that we use for our home visiting program that the health department does, we call it Kane Cares, is the Nurse Family Partnership. And this is an evidence-based model that has a huge impact on not only families immediately, but you know, for my money, the research I think is pretty clear that home visiting is one of the most impactful investments we can make in our community. But Director Barrett's team has been working with the National Program Office, and we are going to be doing some visits with Congresswoman Underwood coming up next month, just to really highlight the program. So that's exciting, and I think it's a great reflection of the wonderful work that the whole team is doing. And Lisa Bloom is our lead on that. We've got some great nurses, Christy and Jill, who are involved in that program. So it's exciting. We also coordinate other home visiting programs within the county too. So we have our own, but we also have a coordinated intake program. But exciting to get this recognition from the National Program Office and be able to bring in one of our federal level legislators to really highlight it. Additionally, I just wanted to make a note that with our behavioral health work that Director Peterson's team is doing, the board authorized a good chunk of money for us to expand services in Kane County. And again, this is kind of two key things that we're trying to do is one, meet some immediate needs, but two, really build capacity for the future. The way the ARPA dollars work, they don't go through our normal health department process. They're in a separate fund, and they actually go through the ARPA, the folks over in the ARPA group. So all of that work goes through the ARPA committee. So we'll be reporting more, and it'll kind of be split over the next few years as we report on that. So we'll give some highlights at this committee. But I don't want to bore you all by making you sit through it twice. So you'll also be seeing a lot more of it at the ARPA committee. But a couple of things that are exciting right now, we're going to be moving forward, looking to get permission from the board to hire somebody new to work in partnership with us and the coroner's office. We are going to start fatality review boards for both overdose and for suicide. So we can look at the statistics, and frequently people say, well, how many people are dying from these things, right? And that's important for us to have accurate information around that. But with these review boards, what we've seen around the country is it's an opportunity to really dig in and see in individual cases what's happened. And that can help us be better informed about what's specifically happening here in our community and how can we better respond to meet the needs of the families who live here. So that's something that's very exciting. And then next month, just a preview, Director Peterson's team has been putting a lot of work into working with our community organizations. So we'll be coming forward with some resolutions to give out about $4 million worth of funding that's going to be coordinated through the health department. So this is just a sneak peek, but you'll hear a lot more about that probably a little bit at this meeting next month, but it'll be going to the ARPA committee for actual approval. So just a couple exciting things that are going on.
Couple of exciting things.
Yeah, lots of exciting things, but really exciting. So as we look at our community health assessment, first off, I want to recognize Director Alleman for her work on this. Liz's position is a new position that we created. One thing when I came into this role is we wanted to commit ourselves to get better information out to the public about what's happening. And I think we're making great strides there. And actually, the whole leadership team is doing a fantastic job with that. And then we did invite our relatively new planner, Sophia Hamilton, who's in the audience. So if you want to stand up, Sophia.
Sophia.
Sophia is a fantastic young public health professional who's just joined our team in the last year. And she has really shepherded this community health assessment process and is doing a fantastic job. So thank you. I want to publicly acknowledge Sophia's great work on that. And hopefully you'll be seeing her a lot more on that. And we're bouncing around here, Blair, on presentations. So just a reminder for folks, the community health assessment process is something that we do every 3 years, and it's in partnership with the 5 hospitals that are located in Kane County. So that's Advocate Sherman in Elgin, Ascension St. Joseph in Elgin, Ascension Mercy in Aurora, Rush Copley in Aurora, and Northwestern Delnor in Geneva, as well as the Inc. Mental Health Alliance, which is the organization that manages the 708 boards for the townships in Southern Kane County and the health department. We all put resources in. The 708 Mental Health Alliance does regular strategic planning and uses an assessment process to inform that. And then each of our not-for-profit hospitals is required by the IRS to do a community health needs assessment every 3 years. So almost 15 years ago, maybe 2010, 2011, we all joined forces and we pool money. This board has voted to approve that the health department is the central driver for that. And we actually collect funds from the partners. And so that we're able to work with a community organization to help us with the assessment process. And this year we worked with an organization called Metopio, which has been doing a great job for us. So again, this is done every 3 years. It's a requirement to do something called iPlan that we need to do every 5 years to be a certified local health department. We are required to do this assessment for national accreditation. Just a quick reminder, we were the first county in the state of Illinois to be nationally accredited. I like to say that anytime I get a chance. So what is this process? So we do primary data collection. So primary data collection means that's information that we're actually getting ourselves. So you can see we gathered almost 2,700 surveys of residents. So this is a questionnaire that's done asking them about their health and issues that are important to them. We did 73 community partner assessments where we actually worked with stakeholders in the community to gather information explicitly from them. We did 10 focus groups, and this varied from seniors to Spanish language to food security, et cetera. It's a diverse group of inputs for us to get more qualitative information. And then we did key informant interviews, and we actually tried something kind of new, and we did AI interviews with our team that we modeled. So as we look at, and I'll talk in the strategic plan, as we talk about how we can maximize utilizing technology, and again, we were just kind of guinea pigs for this process, but our leadership team actually was interviewed by computers that guided the conversation. And it was a pretty unique experience, pretty impressive actually, with the follow-up questions and things. So I think a sneak peek of what's to come in the future. In addition to the information that we collected, this primary data collection, part of the process also includes looking at existing information or analyzing secondary data. So this is, in short, what's making people sick, what's impacting people's health, why are people dying? So hospital data, national data, housing data, et cetera. And we get all that information together, and it's all available on a new, and we haven't even started promoting this yet. So this is kind of a sneak peek for all of you. But this is our Kane Health Atlas. So it's at kanehealthatlas.org. And I just did a quick screen grab here that you can see over on the right. You can pick data elements that you'd like to see. And depending on how specific that data is available, it may be at the zip code level, it may be down at the census tract level. But the public or you as policymakers can actually go on and you can look at this information. You can look at maps. So I've just got smoking rates up here by census tract that you can see. You can look at how different factors go together. So you can model, well, how does smoking and poverty go together? And I think it's going to be something really robust and useful, not only for policy decisions for folks at the municipal level and at the county level, but also for our community partners for grant writing. Something like this is also really valuable. So we do have a website called Kane Health Counts. This is our next iteration of that. So we'll be promoting this much more actively in the coming months. Bless you. So, oh yeah.
I do have a statement. I think this is wonderful. This is something that I've been promoting privately. And really the the knowledge is important, but if we don't disseminate the knowledge amongst the community, then nothing can be done. I was public health chair when we did the national accreditation. And one of the things that they spoke to us about, and one of our golden stamps was our relationship with our stakeholders. So we obviously have that. We've had that for many years. But one of the things that I would love to see is a gold stamp on how we, our relationship with the community. So this is wonderful information. I'm all for it. And we need to continue to find ways to disseminate information. I love the fact that we're hearing more now about home visitors. And as a former home visitor, I can tell you, you catch things. You catch things that are in the house that could be potentially dangerous, not only for the individual client, but for the baby of the client or the mother of the client. So I would love to continue to see these three things together, along with the dissemination of information in the community. So
Excellent.
congratulations.
Yeah, thank you. So once we gather all this information, again, every 3 years, now we prioritize and we pick, okay, what are the key health issues that are facing our community? So we hosted a community forum in May. All of the results, and if you love data, this is a great event to be at. And if you don't love data, maybe not so much. But we share all of the results from the surveys, information from the focus groups, all the qualitative information. It's kind of death by data at this event. But again, if you love it, it's pretty exciting. We had about 50 community leaders who participated. Chairman Strathman participated, and Chairman Molina from Judicial Public Safety, because we have so much overlap with those groups, participated. And the groups, we reviewed the data. We had small group discussion, and we looked at really what's the significance of the issue. So what's the scope of the issue? Oh, this is impacting 80% of people. Okay. What's the severity of the issue? Well, a lot of people have this, but it doesn't kill you. Whereas a smaller number of people may be struggling with this, but it's fatal. So this is more important. And then we also talked about, well, what's happening already and what's our ability to actually change this here at the local level? I put just a couple of examples over on the right. You can see some of the data. So this is top identified community ethnicity, or top identified community issues. And we happen to break it down by race and ethnicity on this slide. But you can barely make out here at the top. Adult mental health and adolescent mental health were the most identified things in our surveys with people. And then down below, I just grabbed fair or poor self-reported health. You've heard me talk about this before. Just those simple questions. We ask about what's the state of your health. And also we ask, what's the state of your mental health? And those are very predictive. Just if you want to know how healthy somebody is, just ask them. And so you can see in this particular slide, we have this broken down here by census tract. So you can see Aurora, Elgin, Carpentersville. We have higher levels of poor to fair health being reported. And this is just one example. We have this data by hundreds of different data elements. But at the event in May, the groups had the conversation, and then we did a couple of rounds of voting to narrow it down to what our top priorities were going to be. And drum roll, we have identified that our top issues for the next 3 years for the community, this is going to inform our community health improvement plan, are behavioral health, access to healthcare, food insecurity, and housing. So these are issues, and food insecurity and housing are certainly a little more upstream, but there are also things impacted by health. It's kind of cyclical, or they feed into each other, I should say. So as people make tough decisions, say around access to healthcare, they may be, the healthcare costs are the #1 cause of bankruptcy in this country, for example. Healthcare costs are reasons why sometimes people don't have enough money for food. And then that also contributes to housing, but both food and housing are very complex issues. Behavioral health, we have talked about a lot, and we're Really grateful for the investment that the county board has started to make in this to be able to respond. And with access to healthcare, we're really looking at what in specific communities does that mean? Because it may be something different depending on where you live or who the audience is. So next steps for this, we're working right now with community organizations and really putting together a formal assessment of what's already happening and what makes sense for at the local level for us to be more engaged with. Some of these things, there was just a Supreme Court decision around people sleeping outside, the Grants Pass decision that has a lot of people quite upset. So some things are at the federal level, but there are things locally that we can do here. And then certainly for all these issues, there's people who are already doing this on a daily basis. So how can we lift them up? How can we support them? How can we find our place where county government is making things better for people who live here? And then after we do this assessment, we're going to be developing our 3-year goals and objectives and that becomes the community health improvement plan. We always like to clarify this is not the health department's plan. This is the community plan. So as we talk about our budget and we talk about funding, we currently aren't getting funding to deal with housing at the health department. We're currently not getting funding to deal with food security. So this is something that we look at, we do the assessment, and we try to find out how we can help other people. And then, as I mentioned, over the next few months, we'll be doing a lot more promotion of the assessment and the new atlas so that people can get the data. We want to get that in front of people as much as possible, as well as being strategic internally, how we're using all this data to drive all of our programs. So there's going to be a lot more information about this in the coming months, but happy to answer any questions anybody may have.
Any questions? Any comments about this? Yes, Mr. Roth?
Roth here. I think it's very good. Something Dr. Silva mentioned, I think it's critical, is have a good explanation how we got to the solution. Because a lot of people will read the final solution and say, oh, well, that's all made up or whatever. And we got to use the science we're using to show that and keep it simple. Because you got to, what's the comment? You gear it towards a 8th grade level almost explanation. Because you go any higher, you lose people and then they.
Dr. Silva?
Thank you, Madam Chair. I didn't mean to cut you off, but I thought your point is so astute because as I'm looking at it, and I'm looking at it from an angle, don't have my glasses on, but it is a little bit confusing, right? So it's a busy, it's a busy look, and I would love to give the information out in different ways that people understand. Some people understand best through reading. Other people understand best through listening. Other people understand best through action, right? So I think that's a very astute point that it needs to be disseminated in a way that we can all understand because we have different learning styles.
Definitely.
So thank you for that, Mr. Roth.
Yeah, and I think my approach to this is really utility, right? So, and I'll argue with people all the time. We frequently have the discussion, well, we need to explain what public health is to people. I frequently will say, I don't think we do. I don't need ComEd to explain to me how electricity works. I don't need NICOR to explain to me how the gas in I need it to work. And I think for the health department, it is exactly what you're saying. We need to get in with these issues and see what do people need to know to make behavioral health better? What do people need to know to increase access to healthcare? And how can we present that, as you said, Mr. Roth, in a way that people understand, that makes sense, that's clear to them? But sometimes I think we get lost in trying to describe our process or kind of the behind the scenes. This is how we do our stuff. And I don't think people care about that. How do we make it better for people? That's 100% agree with you that's what we need to focus on.
I think we do. And also an understanding of history, as was noted in public comment. There are communities that have been severely affected through medicine, through public health. And so there is, rightly so, and we've spoken about this before, a natural distrust. So it's incumbent on us to earn that trust from various communities. I was at a meeting where I almost felt, I'm not going to use the wrong word. I almost felt like this person wanted to push for a county-wide vaccine mandate. And normal citizen. And so as office holders, we sit in very precarious situations because we have folks who, my goodness, this is not right. And other folks who said everybody needs to do it. And as policyholders, we need to understand the passion behind why folks feel the way they feel and try to make the best decision to give people the liberty to do what they need to do.
Thank you.
Just one short follow-up. Keep it simple, Sam. And I think, and I don't know if your department's doing it, but a YouTube channel. And you want to keep them to 3-minute videos or so. Could you get an hour video? You're going to have people want to watch.
Right. No, exactly. And
And keep it
things
to
are changing.
science,
Yes.
not opinions.
Yeah,
Thank you.
exactly.
Okay.
All right. So moving on, and I think Dr. Silva, we didn't plan this ahead of time, but I think Dr. Silva and I are at the same mind with a lot of things. So I just recently introduced the new strategic plan within the health department for how we're going to do things. And again, I look at the strategic plan as, we just talked about topics. What is the community identified as topics? The strategic plan really drives how we do the work and what we need to do to be successful in achieving our community goals. So this plan, I conducted one-on-one interviews with every employee. We do 90-day check-ins with all new hires to see with fresh eyes, what are people seeing? Over the past year and a half, we've done multiple surveys with employees talking about what their aspirations are, what they want to see, what are issues that they're seeing. And these are internal. Again, this is how do we do things? What can we do better? What are opportunities? We have regular town hall meetings where our union staff and our non-management staff is able to come and we're able to have open discussion about what's happening. Planning sessions have been conducted with both leadership and staff. As well as ongoing engagement that we do with community partners and other health departments. On the executive team for the Northern Illinois Public Health Consortium, and am currently the legislative liaison, where we really look every year at all of the issues in the Chicagoland area and statewide that are impacting us. And I'm just finishing up about 6 months of representing Northern Illinois, doing strategic planning for the Illinois Public Health Association. So really, not only what's happening here in Kane County and what's critical to us, but what's kind of what's out there in the field, what's out there in the wild, as people like to say these days, happening in terms of best practice. So we've recrafted our vision statement and our mission statement and our values. And I'll start with our vision statement, where every resident has the knowledge and access to opportunities to live their healthiest life possible. And I think the comments that Dr. Silva just made really are foundational in what we're talking about here. We are partners with the community. We work with people to give them the information to make the best choices for them. So if we have parents who are skeptical about childhood immunizations, my approach is always that we want to start where those folks are. They want what's best for their child. We want to give them the information so that they can make the best decision to keep their child healthy and safe. And we want to provide people with access to resources so that they can do that. So we've rebranded our vision statement to this. And our mission statement's a little longer than I like, but I think it's important, and it actually gets to some of the comments that were made as we talk about Tuskegee and some of these different things that have happened in the history of our country. And I will read it. Our mission statement is to improve health outcomes by working in partnership with the community to understand the cultural, environmental, historical, and social issues impacting our residents' health, so we can effectively direct resources and services in an equitable and inclusive manner. So I'll just kind of talk through that for a moment. So ultimately, we want to improve health outcomes. That's why we're here. That's what we're trying to accomplish is we want people to be healthier. As I mentioned, this is a partnership not only with our residents, but also with community organizations that are helping. This could be law enforcement, it could be hospitals, it could be social service organizations, food banks, et cetera. In order to do that, we have to understand why people do what they do. And that's where you get into cultural, environmental, historical, and social issues. I think anybody who says, well, if you give people the information, once they understand it, they'll do it. I don't think that's ever been the case. We know what we should and shouldn't do, and we're all human beings, and we all have other reasons why we make decisions. It's critical for us to understand that and work together with the community in a way. And again, as the comments that Mr. Roth was making, that we have to start where people are, and we have to understand how people want information. And then what do we do at the county? What does the board do? What does the health department do? We make choices to direct resources into places to make these health improvement opportunities occur. So I think that's the key thing we're doing, is saying, okay, where are we deciding to put resources so that we can help lift our community up to make people healthier? We've also updated our values. I'm a believer that values should be action oriented. So number one is listening. And we have, again, there's a theme that runs through all of these. We need to understand people's concerns. We need to understand what's impacting them. And we cannot just walk into a community, walk into a neighborhood and tell people what they should be doing. We need to first listen and understand what's important to them and work with them. And that is whether you're talking to a parent who has a child with a newly diagnosed mental health issue. That is whether you're talking to a family who may be struggling to put food on the table. First, we have to listen to them. The second, we have to respect. Everybody doesn't agree with us. I reserve the right. I disagree with myself frequently as I get new information and change my mind. And I've never met a person that I agree with all the time. We need to respect other people. And, side note, this would be nice nationally. We could do this too. But we have to get back to where we have the issue is the outside thing. And we're working together to find common ground for how we can improve what's happening out there. And that means working with people who maybe disagree with you and having respect for them and helping. And we had some internal discussion about this. Some of the staff didn't love the term helping, but to me, this is really important because how are we making things better? If somebody comes to us, if a resident calls us, and I actually think our staff does an amazing job with this. If somebody calls and they're looking for something through the state, how are we helping them? It's not just, sorry, we don't do that. How are we helping them, going the extra step to give the resident what they need, whether that's making sure that they do connect with the appropriate organization or us going back and saying, maybe this is a deficit that we should look at. Maybe this is something that we need to get better at being able to do. But again, I think the team we have at the health department does a wonderful job with this. Quality improvement wrapped around always improving. We all make mistakes. We're always trying to get better every day, so that we're constantly striving to get better. When people come forward and criticize something that we've done, how do we listen to that with an open mind, open heart, and say, okay, yeah, how can I get better next time? If the way we did it before wasn't optimal, how can we get better? And then ultimately excelling. Where can we really be best in class? Get more statewide and national recognition, not for recognition's sake, but as a reflection of the great work that we're doing. And when we talk about staff retention and things like that, I think this is important too, for how are we getting out there and really showing that this is an excellent place to work, because people who work at the Kane County Health Department are out there doing the best to make things better for people. So any questions, comments on mission?
Dr. Silva?
That's it, I promise. I feel the reason that staff is maybe trying to get away from the word helping is because there's a lack of balance in authority and there's a lack of balance in power, right? So we do want to get away from the savior complex. So I think, in my opinion, I don't know what staff feels, but how do you feel about the word empowerment versus help? Just a thought.
Yeah, good. Thank you. And I think I'm pretty cynical. I don't know, Dr. Silva, you've known me for a long time. I think things like mission, vision, and values, they're words, right? And we can change them around. That's the cynical side, but then also they can be drivers for what you're doing. So what does it mean? How are people actually living all of these things? And we can flip-flop words and tweak them. But I think as long as that feeling is there for what we're trying to accomplish, I think that's the key thing. And again, really, really fortunate to have been able to work with a lot of great people for decades at the Kane County Health Department. So just a couple things, and I still have the budget presentation to do. So at a high level, the initial areas that we've picked to focus on in our strategic plan over the next 18 months. Number one, how do we maximize and capitalize on a new facility? So we've been working with the board to get a new building or 2 new buildings. If we move, how do we make sure that we have been strategic about really serving the public the best? So that's got to be one of our priorities over the next year. How do we improve how we demonstrate public health expertise? So this goes to how do we support staff, which is its own specific one that we're giving attention to, but also how are we demonstrating that to the public? Increasing direct programming to serve residents. This is something that we've received a lot of feedback in the community. We get asked all the time why we don't provide specific services that maybe other health departments in the area provide. Our staff has continued to bring up to me that they think it would be better if we were providing services. So that's something that we're really looking at, is where are we not duplicating services, but where are we meeting unmet needs in the community so that we can better serve the public. Maximize the use of technology. We have a couple of concrete things that we're working on with electronic health records, with how we do our restaurant inspections and manage our environmental records. Just some technology things internally. I'm working with the IT department on a couple of things where we're hoping to pilot for the county a couple different things. How do we support our employees? And so again, we're putting more of a employee retention plan in place. We do a pretty good job, I think, with exit interviews and seeing why people have left. We're going to start implementing a new policy where we're doing stay interviews to see why do people stay, what are the things people would like to see. And then hopefully we're building a culture where people feel like they have a voice. And again, Dr. Silva mentioned power imbalances. That's something that we want to make sure that everybody has a voice. Again, every resident, but within the health department, we want to make sure that everybody, regardless of their position, has a voice and can share what they're seeing and what suggestions they have. And then cross-cutting all of these things, we have to be able to communicate effectively. Diversity, equity, and inclusion. And I know sometimes that people can have a negative feeling about this, but what we really mean by this is everybody is different. Everyone in our community has a different background. So how are we being intentional to make sure that we are meeting the needs of the residents in the community? And if everybody, if this table, like maybe it was 30, 40 years ago, if it was all white men here, that would not be representative, right? And that has to, now we have more diversity here in this room. We have more wisdom. We have more inputs that are coming into it. All of our program planning, all of our program evaluation also has to have that type of diversity where we have the residents that we're serving reflected. Our staff should reflect the community. So that's really important. That's what we mean by that. And then also funding. Again, where we choose to put resources is one of the biggest things. And how do we get resources so that we can better serve the community? That's a key area of our plan. So happy to answer any questions or if anybody has comments on this.
Any comments or questions? Dr. Silva? Okay. I think those are excellent. It covers a wide range. And I was thinking as you were talking that diversity, we have cultural differences and then we have individual differences within that culture. So it's a big lift to make it personal so that people get it and so that we can help them in the best way that we can.
Absolutely. Yeah. And we've got some great stuff we're building on within the department. Again, I think we're very lucky to have the team that we have.
Yes, Mr. Roth.
One question going way back to when you were doing the updates, the survey of suicides. I'm working with a lot of the veteran organizations. Suicide is a pretty big issue with
Yes.
veterans and stuff.
Yes.
And a lot of times it's underreported. And I know a few months ago when I brought it up with the coroner, he's starting to break that number out. So I'm hoping that we can try to identify it because it can be preventable, but you got to be aware, awareness and also a fear factor.
Right. No, absolutely. And I think
Okay.
both first responders we've talked about
Right.
and then certainly veterans in our Kane County Behavioral Health Council. We've had the VA, the person who managed the suicide prevention program for the VA has been an active participant in that work.
Okay.
So agree. And that's a good example too of specific populations that we need. That's different than
Right. It is.
if there is
different.
such thing as the average resident, right?
Right. Right.
Yeah,
Okay.
excellent point.
Thank you.
Any other questions or comments? Sounds like a great plan to me.
And it's, I hope the team sees that it's includes everything that are, well, I shouldn't say everything, but it includes an analysis and prioritizing of all of the input from our staff. And again, we have tremendous staff at the health department. The people who are on the front line, they know exactly what it is they're seeing. I think Dr. Silva mentioned when you're out there doing a home visit, for example, you're seeing something that I'm not seeing when I sit in my office or when I sit and talk to board members, right? So getting that input from the people who are out there actually doing the work is absolutely critical. And then that leads into our budget presentation.
Before you
Oh,
get
yeah.
there, I
Oh,
just
yeah.
want to say one more thing, and I think it is an excellent idea to do the stay interviews. What a great idea to get feedback from your current staff, because we want to keep you all. So that's a great idea. So, okay, next we go to,
So for the budget, and this is a slide that I've shown many times as we've talked about purchasing a new facility for the health department. At the national level, this cycle here is the 10 essential public health services. We've talked about a bunch of them today. So just around the outside assessment, looking at what's going on in the community, where are problems, how do we find out what's going on so that we can design and implement interventions. So going around, and I won't read it all to you, but policy development and assurance. So in some cases, we're a regulatory agency, right? We're inspecting restaurants to make sure they are doing things to keep people safe. But even in our regulatory role, it's a partnership, right? So we want to find out if a food service organization, if a restaurant is not doing things in the safest way, we want to make sure that they're doing it. We need to assure that they're doing it in the safest way, but we also need to work with them and understand, well, why aren't you doing it? And how can we get you to do it? But again, ultimately, we do have the final authority in those cases to make sure that our food system is safe. You can see on here, legal and regulatory action, implementing policies, plans, and laws, strengthening support, mobilizing community partnerships, communicating effectively. This gets into all of the things that we do. So I think it's just a nice backdrop for what public health is. I include this in the annual budget as we talk about what are our mandates. So this is just some of the things that give us both authority and some of the requirements. So in some cases, we derive our authority from the state to be able to do some of the things that we do. I won't read all of this to you, but you can all have a copy of the presentation. Again, any chance I get, I want to highlight the fantastic staff we have. So this is our current org chart. You can see that we're broken down into 4 operational divisions that are doing this work. So we have health protection, disease prevention, community health, and planning and information management. So any of the outward facing efforts that we engage in are being done by the great people, and the senior leadership team is to my left here, does a great job managing all of that. In the health department budget, we have 4 funds that we're responsible for. Number 1, the opioid settlement fund. So again, this is the lawsuits that are ongoing. And it's kind of exciting because they are ongoing. So we'll occasionally get a new letter like, hey, nationally, there was a new settlement. So stay tuned, more money's coming your way. So it makes it a little harder to project how much money we're going to get. But Kane County is set to receive millions of dollars over the next 20 years or so. This fund, again, just as a reminder, is managed by a separate committee here that is made up with myself and Chairman Strathman, and the state's attorney, the sheriff, and the coroner make the funding decisions for that fund. Fund 350 and Fund 351 are the core health department operational budget. So Fund 351 is Kane Cares, our home visiting program. 20 plus years ago, it was established as its own separate fund. So it's separate from the rest of our programming, but I kind of look at those two funds together. And then one of the Fund 355 ARPA funds is the $10 million investment in behavioral health that the county board made. So as I mentioned before, that does not go through our usual internal processes at the health department, but is done in partnership with the ARPA staff, but you'll be getting more information about that. So what we're seeing for fiscal year 2025, just about $9.5 million for Fund 350, $685,000 for Fund 351. We've been working very closely with the finance department to make sure that all of our reports are correct. I did not want to present information that didn't make sense to us, or that we didn't understand, or didn't include all of the positions, for example, that we wanted to include in our budget. So we have made a tremendous amount of progress with the finance department over the past couple of months. But that is also why we just were able to run a report yesterday that I think we can stand by, that really reflects what it is that we want to propose for our 2025 budget. So I did email that to the health committee members, and then we can pass it along to the full board as well. If anybody does have any questions when you have a chance to really dig through and digest that, happy to talk about that offline in one-on-one meetings, or happy to come back and talk about it more next month if people do have questions. But a few key points I'd like to state. The health department always presents a balanced budget. So again, we don't get any money from the general fund. There is a special tax levy for public health that was established about 40 years ago. That, like a lot of the county, that levy has been flat. So we have been collecting just under $2 million. We had that last year. We had that 5 years ago, 10 years ago, almost 15 years ago. So with healthcare costs and raises that people have received, the cost of doing business going up, our net investment from local tax dollars, I would say, has gone down significantly. I have presented, I want to keep this positive today because there's a lot of exciting things going on, but I will point out I've presented slides and data to the full board showing that in the collar counties, Kane County has significantly lower per capita investment in public health through property taxes than any other health department. So when we compare ourselves to any of our neighbors, we have the lowest investment in public health. So that's something I know we have some financial issues as a county we're looking at, but that's a truth that I want to make sure if there ever are increases, to make sure that the health department's included in that. I do also want to make a clear statement that because we present a balanced budget and we are self-sufficient with grants that we receive and with fees that we collect and with the property taxes that we collect, when we have a project, if that project is grant-based and the funding goes away, if we don't have other funding, then those expenses are cut. And there's been different discussion I've seen at the finance committee and things. If a project goes away, it goes away. And that may mean that the staff go away with it. So we live within our means and we'll only spend money that we have. Additionally, I'll note that especially in Fund 350, over 40% of our revenue comes from grants. That's partially how public health is funded in this country, but also it's a challenge for us because every grant has its own deliverables. Every funder wants you to do something. So this is different when we talk even about how we talk about mental health. People will say, well, why don't you do X, Y, Z? Well, if I'm getting suicide prevention money over here, they may want me to use Model ABC. They're giving us the money. I have to use Model ABC. And if I'm getting opioid money over here, they may want me to do X, Y, Z. We have to do X, Y, Z. So every grant that we have is a project that's time bound and has its own deliverables. So again, that's another reason why I would advocate for more general money or an increase in the public health levy so that we would have more money that we could be creative with.
Silva?
I would caution us against using statements like we have the lowest investment in public health in Kane County, because then that gives, again, talking about perception, that's not a perception I want to give. If you as director have a need, then that needs to be presented before the county board. And then we have to make that decision. But I really want to steer away from the thought that we have a low investment in public health.
Yeah, I respect that. It's math though. I mean, if I show the per capita investment, I could avoid the statement, but it is a statement of fact.
I'm not disputing the amounts. What I'm disputing is the statement, because as a board, if you bring something to us, then we can consider it. And if it's a dire need, like a new building, then that's being considered, obviously. And we're really bending over backwards to be able to provide you with that. So it's not the desire to have a lack of investment. It's what's brought to us. And then we deliberate and do what we can. So it's not really the feeling of a lack of investment in public health. It's what is brought to us.
Okay, very good. And also the budget does reflect that we've been able to successfully increase our revenue by 7.8% with our grants. So that's exciting as health department staff is out there trying to bring in additional resources. We have been quite successful there. And then the final bullet point there is that this reflects us spending some of our reserves to expand service lines so that we can have proof of concept to bring in additional revenue from outside sources. And whether this is through Medicaid billing, additional grants, fee for service, that we're making this investment now intentionally with the goal that we'll be able to sustain the new service lines that we're doing. So anything that we look to grow, we want to be able to sustain that and again, be self-sufficient. So those are highlights for the budget, I think. And we can talk about any questions once you have more time to look through any of the details or specific line items or where we have it. But I think there's a lot of exciting things that we're proposing for 2025, certainly.
Do we have any questions or comments? Okay. I think that Dr. Silva has shown us that she's a wordsmith this morning. And I think words are really important, but I also think that there might be a better way to say that, it's not a time and staff investment in the community, it's money, right? I mean, because with what we do with what we have is amazing.
Right. Oh, absolutely. Oh, absolutely. I'm very positive about that. Like I said, we were the first county health department to achieve national recognition. So we have people who are doing fantastic work. And also I hear frequently from board members and residents, hey, how come I was just in Kendall County and they were able to do this? Or I was just in DuPage County and they were able to do this. We also listen to those things and try to identify, well, where are there opportunities where we can better serve our residents? Certainly.
Okay. Thank you. Any final comments or questions? Okay. So then, moving right along, we have a resolution, which is, do I have a motion and a second and possible discussion of authorizing the agreement between King County Health Department and Aurora Public Library District for naloxone vending machine?
Tarver moves.
Carver moves. Do I have a second?
Truby seconds.
2 seconds. Okay, Mr. Isaacson.
So we actually, both of these resolutions are quite similar. So hopefully it'll be easy to discuss. This is for us to partner, and the first resolution that we're discussing is with the Aurora Public Library to be able to put naloxone distribution, a vending machine in their facility. I'm thankful to the staff in the civil division at the state's attorney's office who's been very helpful as we've looked through these agreements with these community organizations. We're bringing this to the board. This is a new thing for us to do, to put these machines out or to put the ability to do the vending out in public places like this. So we want to make sure that the board is authorizing us to do it. as we share in our trainings, naloxone is safe, but it is a medication. So we just want to make sure that the board is actually blessing us in doing this.
I think it's very exciting.
No. Yeah. I was just seeing if anybody from the ASA was here, if they wanted to.
Okay.
Okay. Yeah, I think they're available if there's any questions. but-
Okay. Do we have any questions for the state's attorney's office? Mr. Roth?
Not for the state, more for Mike. This funding is from.
It's
the-
a combination. So we receive some federal funding that is passed through to us from the Illinois Department of Human Services. So that's what we're looking to spend.
Okay.
And then also we may be using ARPA funds in the future.
Okay. And then is this the first implementation of this program?
It is.
And then is our goal to get in all public libraries in King County or all, more than just libraries, but other places too? Right?
Exactly. And we have other partners that we're working with in the community who are also doing it. So
Okay.
yes.
And are you identifying those by where it's happening, where overdoses, or you just whoever you come across first?
It's both. So we are using the data to drive where we want to prioritize, but unfortunately, this is something that's a threat all over the place.
Yeah, no, I understand. Thank you.
Yes, Ms. Juby.
So have we looked at partnering with restaurants and bars? I mean, we talk about meeting people where they are. How is that going?
Yeah, it's going well. And actually, we are just launching, not exactly bars, but Director Peterson's team is working with River Edge Park, where we're going to be at concerts providing naloxone to people. So I think the work continues to get in. And it's exactly what you're saying. Where are the people going, so that we can reach them? So, and I don't know, Kim, if we have restaurants and bars that we've worked with, but it's a great idea.
Yeah, I think in the future, we've talked a lot about, again, looking at the data as to the geographical locations that make the most sense and then targeting restaurants and bars in those areas. We've thought of, window decals that say we're an Narcan provider, leaving some of the leave behind kits there, offering to train the staff on those life-saving techniques. So that'll be something we're diving more deeply into as the years go on. And again, places where people aren't going to be afraid to go up to the vending machine and grab it. So even gas stations, though, that's a lot of times in the restrooms where overdoses happen, Walgreens, different things like that, where there's public bathrooms. So if there are businesses or folks you guys know that would be willing to have these life-saving materials within their business and help partner with us, that would be awesome. We're just getting started on the plan for that and how we're going to roll it out. And the River's Edge Park is one of our first steps.
I know I gave a sample a few samples that I had to my college-age grandchildren and a roommate who is a bartender. So, I figure they possibly are in a target-rich environment. So that's what I did. So,
Thank you.
Madam Chair.
yes, Mr. Roth.
Has some thought been work with your health inspectors going out to restaurants and not necessarily a vending machine, but actually training the staff and they are kind of on site? Because if it happens at a lot of those places, it's probably critical to have them trained.
That's part of our goal for sure,
Okay.
is to definitely, this is a life-saving technique, just like
Right.
CPR. Hopefully
Exactly.
we can all be armed with that knowledge in the future.
Thank you, Kim.
It's amazing to me what a short time ago it was that first responders could not carry this.
Right.
So this is such an amazing development. So we can all be proud of what you're doing. So thank you. So we need to take a vote on, can we do both of these resolutions together?
Well, I do them separately since
Okay.
they're different. They're great different entities.
First one then, so we have a
I go and
motion.
might go faster.
Yes, so we have a motion and a second, so please take the vote on resolution 24-2656.
Juby? Silva? Tarver?
Tarver, yes.
Williams?
Yes.
Strathman?
Yes. Okay, and in the same vein, but different. We need a motion and a second for the resolution authorizing agreement between Kane County Health Department and Copley Memorial Hospital.
Tarver moves.
Carver moves.
Stevie seconds.
3 seconds.
So same thing, only this is our first foray into putting these in a hospital. Because it is a medication, there's more complications that it makes it much harder for the hospital to be able to do it. But for us to work in partnership with them, then we're able to provide the naloxone. The naloxone is being paid for by the state of Illinois, so it's free to us. It's free to anybody who wants it.
Are they also paying for the vending machines?
Now, we're paying for the vending machines.
Okay, so any other questions or comments? Okay, then please take the roll.
Juby,
Stevie, aye.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Yes.
Strathman.
Yes. Passes. Okay, do we have any old business this morning? Anybody? Okay, so whatever there this morning. Okay.
Almost
I'd
the
like
200th day of the year, so it's been a long year. So it's almost the 200th day of the year, I hear, so it's, yeah.
You could ask for unanimous consent to place.
I will now ask for unanimous consent to place the reports on file. Anybody?
I ask for unanimous consent to place the reports on file.
Thank you, Dr. Silva. Any objections?
It's done.
It's so, and as Mavis says, so let it be. Okay, and we've already done the closed sessions and any new business.
You have goals and objectives.
So we had goals and objectives for us for this. I saw some great goals and objectives that were presented this morning on your report. I think that, does anybody have anything to add to that? So,
Question.
yes,
Isn't this the goals injected of the committee, not of the public health?
well, it's of the Committee for the Public Health.
Right, I understand that.
Right, so,
Okay.
I mean, I think that
Thank you.
does anybody have anything to add that we want to say for the Public Health Department? So I guess we will craft some of I think we can steal a little bit is what I think we can do. Yes, Ms. Juby.
So is this like the 2-sentence
Yes.
thing that we're supposed to decide? Okay, so when we're crafting from the wonderful things that Michael said, because we are going to take them, can we also make sure that we get something from Brett in there as well? You know, so maybe you could write our goals for us, please. I mean, I just want to make sure we cover
I think that's an excellent point.
everybody.
Yes,
So,
it's health, but it's for different creatures. So all of us are different creatures, right? So- Wait, 2-legged or 4-legged, so, okay. I'm sorry, if you could go to the microphone, we can't hear you just without this.
You guys do really go the long way. But last night when I was online to sign up to speak, it said we have 5 minutes for agenda, 3 minutes for non-agenda. Now, when I have had some people of authority, they know, they're smart, they're here. They said the 3 minutes has not passed yet.
Okay.
And
you
we
know what?
need to
You are
follow the
right.
rules.
You are right, Ms. Meyer.
So I would ask to finish while the rest of the board is here, my 5 minutes,
Yes, let me
please.
explain. I was gone. I thought that we had passed it. My apologies to you. And if you'd like to finish your statement now, please go ahead.
Thank you so much. Okay, and I don't like to speak in public. I flunked public speaking. It makes me very nervous. I'd rather crawl under the bed, but I have strong and passionate patriotic feelings, and in healthcare, first do no wrong. So this
You
is
have
where
2 minutes.
this is where I left off. You interrupted me and I'd like to have more. Okay, so starting now, please. Holy moly. Okay, why doesn't the board craft a statement to the global, national, and state toxin pushers to cease and desist? Why doesn't the board tell the laboratories, some in the United States, that continue to do those experiments to make viruses, I'm nervous, to make viruses more virulent and deadly? Why don't we put through to those people that we, the American people in Kane County, have had enough? How will Kane County respond to the next pandemic? Be bold, be courageous, exercise local control. First, do no harm. Now, I have a couple of comments from what we just heard. Years ago, I asked Walgreens, because I'm that kind of person, God makes me question everything. I wish he didn't. But I asked for the COVID vaccine insert, and there was no insert, but they gave me a photocopy, which had a long list of the many serious side effects, including pericarditis and myocarditis. Not safe and effective. It does not stop the spread of the disease. What do people need to know? This was said. Unfortunately, let's give a couple examples of some more public health things. The food pyramid, 1970s. Any good farmer, Mr. Kenyon, I bet you could tell us that when you feed grains to animals, they put on weight quickly, so they fattened the entire American population with a falsehood. It should never. Grains do not go on the bottom. All right, let's just talk about in intensive care, taking advanced cardiac life support back in the 80s. We were told that if we did not know anything else to do on this cardiac arrest, that we should give sodium bicarbonate every 10 minutes. Now,
That is your time, Miss Jean.
they don't give sodium bicarbonate anymore because it worsens the outcome. What is truth?
Thank
We
you,
need
Ms.
to make
Myers.
sure.
Thank you. Okay. So I need a motion to adjourn. And a second, please. Do I hear a second?
I'll second.
Okay, thank you. All in favor, say aye.
Aye.
Thank you. We will see you next month.